There are a lot of tall tales about Texas, but we live here. We raise our families here. We serve our communities here. We know Texas families and Texas struggles. We are the Methodist Healthcare Ministries. We keep low-income and uninsured South Texans healthier through strong programs, reliable partnerships, a rock-solid financial foundation, and unwavering faith. And even as state and federal funds are cut for essential human services, we continue to reinvest in the people we serve. At the end of our first 10 years of service, we were delivering 347,000 client encounters. Today, in the middle of our second decade of service, we are meeting 771,000 individual needs in a year. Our spending remains strong, too, growing from $36 million at the end of 2006 to a budget of $60 million today. Through our hands, we do His work. Despite a challenging economy and charitable giving climate that doesn't appear to be giving anyone a break, yet we remain an enduring beacon of light, a safe harbor that delivers quality care and critical assistance to growing groups of families and individuals in need. Problems don't disappear when government funding is cut. Chronic health issues don't magically improve. Children can't instantly begin to care for themselves. But we're still here, yesterday, today, and tomorrow. We listen to the stories, we offer support. And we know we're helping so many in so many ways. In the MELD program, young parents meet regularly in peer groups to learn practical parenting techniques, share experiences, and learn from each other as they raise their children in this challenging world.
It was very difficult and frustrating before I started coming to these classes because I used to get depressed a lot since I didn't know what to do. I'm a single mother with 4 kids and family, and as they get older, it's much more difficult. It was frustrating, but these classes have helped me a lot. It's like everyone who comes here is my family, because I don't have any family here in San Antonio.
And we offer help at home, too, through a series of one-on-one visits from a certified parent educator who nurtures the natural instincts of moms and dads and encourages the child's healthy early development.
Although I do have 4 kids, now I don't feel like it's too much to handle. I've learned a lot. I talk with them more often, I play games with them. It's also helped me a lot with my other children. I didn't give them enough time like I do with her. Now I give her lots of time and I pay attention to what she's doing. Before, I didn't do that because it was one after another and I didn't give them as much attention. I would take care of them, but it's better with her now than it was before.
Healthy development continues throughout our lives, and our community programs put a little extra spring into the steps of hundreds of seniors across South Texas.
My life was a deadbeat. I was a stay-at-home mom, grandma, great-grandma, and I was just plain bored. Until I read in the Reporter about this program, I called and I came and joined, and boy, I went up to heaven.
Physically, it has helped me, my health, my muscles, they have straightened. And doctor is very, very proud of me for coming to these sessions, yes.
Satisfaction, relaxation, a peace inside. I'm too tired to argue with my wife when I get out of here and feel good enough to go to work.
At the Wesley Health and Wellness Center in South San Antonio, we work with people of all ages and of all needs. There are exercise and enrichment classes for adults, nutrition classes for families, and healthy eating education for those dealing with chronic illnesses. It's a gathering place for support groups and an after-school activity center with healthy snacks for growing stronger minds. It's a place people go when they need help. No questions asked. And for hundreds of families and individuals, it's also a healing center from head to toe, staffed with dental and medical experts and state-of-the-art equipment delivered at little or no cost.
If it wasn't for Wesley, I don't know what I would do. I would have to take him to a private dentist somewhere, and they would have to extend credit, because I'm disabled and retired, and I couldn't afford to pay Jacob's dental procedures.
Like a big old family in many, many ways.
If you go somewhere else, you have to pay them or else they won't see you. But right here, you know, that's what I like about here, you know. They help you for everything, even if you need clothes, if you need food, they'll give you food. If you need, you know, medications, they'll give you medications. They'll give you everything, and they'll keep you happy. And if you have problems, you have your own counselors. And then if you're sick about your dental, they'll help you with dental too.
Cuando la primera vez que vine
When I first started coming here, I saw that it was a religious institution. And I realized that these are people who look towards religion too, who look toward God through their desire to help other people.
por Dios y por querer ayudar a otras personas.
Our clinic services extend a wide spectrum of care to adults and school children, providing medical, dental, and social services to those who cannot afford health insurance and who do not qualify for federal or state programs. Through one-on-one and group meetings, MHM is on the front line in the growing battle with obesity and diabetes, childhood wellness, mental health issues, and substance abuse. Our largest outreach program, the Wesley Nurse Health Ministries, is expanding to serve individuals and families in 80 sites. Wesley nurses partner with other agencies and community programs delivering a holistic approach to enriching the mind, body, and spirit. From educational outreach to emergency financial aid, and from organized dental clinics to vibrant exercise classes in church activity centers, Wesley nurses care for their community as a whole. The faith-based programs of the Methodist Healthcare Ministries, as an outreach of the United Methodist Church, are a caring first point of contact for those in need throughout South Texas. We freely open our hearts to today's underserved low-income families and are prepared to offer care to the growing numbers of tomorrow. We serve with His grace to do His work through our mission of serving humanity to honor God.